This presentation explores what causes Lyme disease as well as the treatment and prevention. What is Lyme disease? Lyme is a vector-borne disease. A vector is an insect such as tick, fleas, or mosquitoes. However, the black-legged tick, also known as the deer tick, is the only tick that can carry Lyme disease. Lyme comes from the bacteria called Borrelia burgdorferi and Borrelia mayennii. The bacteria enters via tick bite and will make its way into your bloodstream. In order to get Lyme, the tick must be attached for 36 to 48 hours. Deer ticks. Deer ticks can live for up to 2 years. These ticks get Lyme from animals who already are infected. Tick's life cycle consists of 4 different phases: the egg, larvae, nymph, and adult. Deer ticks feed only 3 times in their lives: once when they molt from larvae to nymph, again to molt from nymph to adult, and a third time to lay their eggs. After a female lays their eggs, they die. They typically lay their eggs under leaves. Deer ticks only feed on animals and humans' blood. Where do deer ticks live on Cape Cod? Ticks prefer the edges of woods, stone walls, and shady or moist areas close to the ground. Ticks can also be found in lawns as well as gardens. Ticks will climb and cling onto strands of tall grasses, brush, or shrubbery. Who can get Lyme disease? Cats, humans, dogs, cattle, horses, chipmunks, raccoons, and squirrels, and etc. can all get Lyme disease. Most mammals can get Lyme disease. Symptoms of Lyme disease. There are 3 stages to Lyme disease. The first stage is early localized disease. The second is early disseminated Lyme disease. And the third stage is called late disseminated Lyme disease. The most common and typical first symptom of Lyme is bullseye-shaped rash called erythema migrans rash. The rash is typically seen at the bite site, but that's not always the case. The rash appears anywhere from 3 to 30 days, but typically it'll show up in about a week. It can appear anywhere on the body and can expand up to 12 inches or more over several days. These typically appear in all 3 stages of Lyme. The first stage is called early localized disease and takes place 1 to 2 weeks after the bite. Symptoms include the erythema migrans rash, chills, fatigue, stiff or swollen joints, headache, dizziness, fever, difficult sleeping, swollen lymph nodes, trouble focusing, and other flu-like symptoms. Early dissemination Lyme disease shows several weeks or months after the tick bites. This is the second stage of Lyme. Symptoms include a rash that may appear anywhere on the body, most commonly near the site of the bite. However, several rashes may also appear. Lyme can also cause Lyme carditis, which causes the heart rate to dramatically slow down. Other symptoms include numbness, tingling, meningitis, facial and cranial nerve palsies. The third stage is called late disseminated Lyme disease. This occurs if the disease goes untreated for long periods of time. This may occur months or years after a tick bite. According to the New England Journal of Medicine, between 10 and 20% of people continue to have symptoms of Lyme after treatment. The symptoms consist of arthritis, encephalopathy, which is damage to the brain. It can cause mental fog, short-term memory loss, trouble concentrating, and trouble sleeping. It can also cause numbness in arms, legs, hands, and/or feet. Treatment of Lyme disease. To be treated for Lyme, you must be seen by a doctor. Your doctor will look for the symptoms listed before. You typically will not be tested in the first few weeks because the blood will not show the disease. Treatment can include oral antibiotics or intravenous, also known as IV antibiotics. Here you can see the medication, dosage, and typical amount of days to treat Lyme in both adults and children. It does vary depend on the person's medical history. This information was taken from the CDC or Central for Disease Control and Prevention website. The most common treatment of Lyme are oral antibiotics. These medications include amoxicillin, dioxicillin, or sulfamine. According to the National Institution of Health, there have been several studies that show the majority of people do heal within a few weeks after starting oral antibiotics. In some cases, an IV antibiotic is needed to treat it. This typically happens when people who have an underlying medical condition such as cardiac or central nervous system involvement get Lyme's. Prevention of Lyme. There are several ways to prevent Lyme disease. Wearing long pants and long sleeve shirts and closed-toed shoes while outdoors is a great way to prevent it. You can also use bug spray with 10% DEET. DEET will protect you for 2 hours at a time. DEET cannot be used on pets. Talk to your local vet about the best products to protect your pet. Some vets may recommend Frontline, but it's always best to talk to your vet first. It is important to check yourself, pets, and children for ticks after being outside. It is important to check the hairline and the hair behind the ears, under the arms and legs, under armpits and behind the knees, between toes and around the groin, as well as the belly button. It is important to check your dogs as well. In and around the ears, around the eyes, under their collar, under the front legs, between the back legs, between the toes, and around the tail. Same goes for your cats. If a tick is found, it's important to quickly remove the tick with tweezers on a human or an animal. If it's on a dog or cat, you can use a special tool such as the tick remover. It is recommended by Maine CDC. Using tweezers or the tick remover, pinch the tick as close to the skin as possible, then pull straight up. This will remove the tick. Keeping your yard clear of sticks and leaves and your grass well maintained can also help to limit the amount of ticks. Remove anything ticks can hide in, such as old furniture or trash. Try to keep unwanted wildlife away from your house can also help prevent ticks. Finally, treating your lawn with pesticides can also help to reduce the amount of ticks.